So thanks everybody for coming. This is the ninth annual Codman Shoulder Society meeting, and the first time we've really done a partnership with two others. Now we've partnered with Avant-garde in the past, but never with the Journal of Orthopedic Experience and Innovation. So this will be flavorful for sure. I'd like to thank Ira and Derek for partnering in this presentation. And just by way of introduction, the Codman Shoulder Society was founded in 2014 because I work in the home of Codman, which is a Mass General hospital. Codman was actually the first person to introduce the concept of the end result about 100 years ago. And that concept was to determine best practices to optimize outcomes by measuring, something which has since been scaled significantly. But more importantly, he was also an entrepreneur. And the question of innovation is something he addressed early on, and he suffered for it, frankly. He said, give me something different for there's a chance of it being better. Folks in those days didn't really like different things. Among the things that he accomplished during his lifetime included the end result concept, and you can see these boxes in which he had end result cards measuring the outcomes of all his patients. He believed that outcomes should be measured, and if patients didn't have satisfactory outcomes, they should be refunded. In those days, we didn't have the same insurance situation, so patients often paid. He created the first anesthesia record with his colleague at the Brigham. He created the sarcoma registry. He was the first to use x-rays for fracture treatment. He was the first to publish a book on the shoulder in English, and the first to write a book on hospital efficiency. Now, many of you know Michael Porter, and while Michael Porter's been incredibly influential, and Susanna Galani, who's our keynote speaker, had worked with him and been part of his value-based healthcare initiative, it was really Codman who started the ball rolling. He just called it the end result concept, and Porter popularized this in this book, calling it value-based healthcare, which basically has been a movement for some time now. The Codman Shoulder Society has had a number of meetings, most of them on site. This was our 2016 meeting. Our visiting professor at that time was the world's expert on evidence-based medicine, Mohit Bhandari, who talked about evidence and value and how we can align these. Then in 2019, Bob Kaplan was our visiting speaker, and he talked about how to measure outcomes and quality in healthcare. And then in 2022, we specifically looked at digital technology, and we're going to have a presentation on that today as well. And then in 2023, we had a program on innovation, entrepreneurism, culture, value-based healthcare, and leadership and career development. Our keynote speaker at this meeting is Susanna Galani, who's been kind enough to come and give her time. She's the Thai Family Associate Professor of Business Administration, and she works in the accounting and management unit and has contributed quite significantly an executive program at Harvard Business School, including the program for leadership development, managing healthcare delivery, driving corporate performance, and working in the healthcare delivery and leadership program at Harvard Medical School. And her talk's going to be on physician-hospital alignment, and that'll be beginning of part of the first part of our presentation. So with that, I'm going to just sum it up by thanking Ira and Derek, and I'm going to yield and let each of them come on and say a little bit about their companies.
Derek, why don't you go first?
Great. Thanks, Ira. Thanks, JP. Very excited to be connecting with everybody today. So I know many of the folks on the conversation this evening are physicians. Just wanted to start off with a little bit of background on my own family. So I grew up in central Massachusetts in a town called Shrewsbury. And this picture is very meaningful to me from 30 years ago, now the same age as my parents were and have my own kids. And at that point in time, we had an exchange student from Japan that lived with us. And then there's my mom, my dad, my brother, my sister, and then myself. So only non-physician in my family. I grew up hearing about ultimate challenge and frustrations they've been experiencing trying to live a high-quality care and increasing resource-constrained environment. And so this was a big influence with me on starting Avant-garde Health back in 2014. And Avant-garde Health grew out of work I was doing with Mike Porter and Bob Kaplan. It's co-leading their value-based healthcare research. I actually met JP back in January of 2013. We were both taking the intensive seminar together at the school. And through Avant-garde Health, we work with health systems, surgery centers, and physicians to help them get as robust a set of insights as possible into all the different facets of their surgical care and help them understand where the opportunities to improve how they deliver their care to do it in the same or higher quality, but a more financially optimal way. And recognize, many institutions are under a great deal of financial pressure. We're able to help through our analytics, help people understand where the opportunities to improve the care processes, the flows, types of staff who are involved delivering the care, how much time people are spending, be able to help optimize and improve the surgical throughput. And weave in all the great information around enhanced recovery after surgery, patient-reported outcomes, and also ensure cases are accurately being coded to provide holistic insight into opportunities to improve the care flow. And so with that, I'll pass the baton to Ira.
All right. Thank you. I am going to just briefly introduce the Journal of Orthopedic Experience and Innovation. This was my second publishing effort. My first was in the 1990s when I was one of the 12 founders of Medscape, and we took it public in 1999. And I don't know why I waited 25 years to do this one, but about 4 years ago, I felt that there was a problem in publishing for a variety of reasons. Surgeon experience wasn't being valued. There wasn't a voice for innovation. Innovation did not come out and publish early. And so we came up with the Journal of Orthopedic Experience and Innovation. It's been nicknamed JOEI, J-O-E-I. Our mascot is a kangaroo. We pride ourselves on our editorial board, which is quite a lot of people. Some are here tonight. We run many articles on innovation and experience. We even have a series called In My Experience, where surgeons really focus on a very specific aspect of their experience. And just to kind of finally just show you the real data, we started 4 years ago on March 14th, 2020, the first day of COVID lockdown. We'd like to feel we're more viral than COVID right now. We have 15,000 page views, 12,000 article page views, and almost 10,000 unique visitors a month. So we're pleased and want to thank a lot of people who are on this call right now who have been authors. And some of our articles get as many as 20,000 views. We want to thank our authors for that. So I'm going to stop my share right now.